Good evening and welcome. I'm Michelle Leifer, the director of the USDAN Institute for Animal Health Education at the Schwarzman Animal Medical Center. Along with my colleague, Kimberly Young, I want to thank you for joining us for tonight's webinar, Feline Dental Health with Dr. Ada Toe. This webinar is for informational and educational purposes only and is not a substitute for professional veterinary medical advice, diagnosis, or treatment. If you have questions or concerns about your pet's health, it is always best to consult your veterinarian. Tonight's session is being recorded and we'll send a link tomorrow so you can revisit any part of the presentation or share it with a friend. We'll be taking questions via chat and we'll set aside time at the end to answer as many as possible. I'd like to take a moment to let you know about next month's webinar. On Wednesday, March 19th at 6 p.m., we're excited to welcome Dr. Vanessa Spano, AMC's first ever veterinary behaviorist and the only board-certified veterinary behaviorist in New York City, for a special session, Behavior Solutions for Pet Owners. For more details and to register, go to amcny.org/events. You'll also find the link in our newsletter going out this evening. And now it's my pleasure to introduce tonight's speaker. Dr. Ada Toe is a third-year resident veterinarian at AMC's Dentistry and Oral Surgery service. She earned her veterinary degree from the Ohio State University College of Veterinary Medicine, then completed an internship in small animal medicine and surgery at Blue Pearl in New York City before joining AMC's very busy dentistry service for her residency. We're delighted to have her here tonight to share her expertise on feline dental health. Please join me in welcoming Dr. Ada Toe.
All right. Thank you so much, Kimberly. Sorry, Michelle and Kimberly, for everything, for setting this up. I'm excited to go over feline dental health with everyone today. And just making sure the screen, everyone can see the screen right now, the PowerPoint, or not,
Not
not
yet.
yet. Okay, got it. Let me just get that together. Okay, and seems like the
Good.
screen is being shared now. Okay, sounds good.
Yep, perfect.
Okay, so let's just get started. Let me see if this. All right. So goals today is that we're going to start by reviewing some basic feline dental anatomy. And then we're going to understand some common feline oral health issues and a little bit of slightly uncommon ones I put in there as well. Overview of treatment options for these health issues as well. And then the what you can do at home for at-home oral care and evaluation via either your regular veterinarian or just yourself. So again, just we're going to start with at the age of kittens, talking about persistent deciduous teeth, traumatic malocclusions, and then a lot of things that I get referrals about are early onset gingivitis and aggressive periodontitis. Then we'll lead into feline tooth resorption, feline chronic gingivostomatitis, periodontal disease, which is still very prevalent in our cat friends. And then what exactly is a professional dental evaluation and treatment and what we do here, and then recommendations for at-home dental care. So some kitten dental basics. So we'll start with how many teeth cats have, starting with baby teeth. So your deciduous dentition formula. All in all, your baby kitten should have a total of 26 teeth coming in. You have your front teeth, your incisors, which would be 6 total. Your canine teeth, again, this is just a formula that we remember it by, 1 in each quadrant. The premolars, 3 on top and 2 on the bottom. Their molars don't come in until they're adults. So everything's the same for the adult dentition formula compared to the baby teeth, except the adult molars come in. They do not have any baby teeth counterparts, and then a total of 30 teeth total. And this is just an example of a chart we use for baby teeth. The only big thing that's missing is that these bottom molars here and these top molars come in when they're adults. And then this is just an example of, we're petting, but we're never looking in the mouth what these cat's teeth look like. This is an example of an adult. This is a side view. And then you have your front view, and he has kind of a wonky occlusion, which, we'll get into later. Eruption pattern in kittens. All the baby teeth should be present at 6 weeks of age. Again, you have your outliers where it does take maybe another 1 week for all of them to come in. And then this is just, it has both the puppy and kitten. This is just how many weeks per section of when the teeth come in. So your front teeth, your incisors, about 2 to 3 weeks, your canine teeth, about 3 to 4 weeks, and your premolars, about 3 to 6. All the adult dentition and all these baby teeth should be gone by 4 to 6 months of age. Sometimes we give it another extra month, so 7 months for fully all the teeth to come in, especially your premolars and your molars. But that's usually around the time frame of when we should not be seeing any baby teeth left. So after talking about dentition, and the number amount and how many should come in, we want to look at occlusion. So what exactly does it mean to have a normal occlusion in a cat? So in here, these are great examples. So in the first beginning on the top picture on the right, you see the frontal view of a cat skull. Those front teeth on top, your maxillary teeth, should be sitting right in front, just right in front of your bottom teeth, your mandibular incisors. And then on the side view, that bottom canine should be sitting in between that top canine and that third incisor right there. I don't know if my pointer's showing up here, but that's where the normal occlusion should normally be. And also on the side view, you should have like a scissor-like projection or pattern where they're kind of interdigitating with one another, the top and the bottom teeth. So those bottom premolars are usually sitting right in front of the top premolars in a scissor-like pattern. So a type 1 malocclusion, so now we're getting into the abnormal types. So your upper and lower jaws are basically the same length. There's no difference in length of them. But you have one or a couple teeth that are out of place and misplaced. So one example, again, I know this is a picture of a dog. This is not very commonly seen in cats, but one type of this type 1 malocclusion is called a rostral crossbite. And what you see is that those bottom teeth that should be sitting behind your top front teeth are just sitting jutting right in front of it. So those bottom teeth are in front of that top teeth. That's not normal. That's a type 1. This is a good example of what we call a caudal crossbite. And this is when those bottom premolars and molars should be sitting behind these top premolars and molars, but instead it's sitting on the cheek side instead. So that's what we call the caudal crossbite. And then this is just an example. This cat has normal jaw lengths, but this one canine tooth, if you could tell, is jutted way forward. That should not be like that. Whether it's, how he was born with his baby teeth before, we won't know, but that's just an example of another type 1 malocclusion. Type 2 malocclusions are when now we're talking about jaw lengths. Your lower jaw is shorter than your top jaw, basically, or what we like to call in layman's terms an overbite. This is an example of a patient we saw, and he's going to come back to play in a little bit down the road. Type 3 malocclusion is when you have your lower jaw, like your pugs, and that lower jaw is longer than your upper jaw, and or layman's terms is underbite. This is a very cute cat that has an underbite. And again, we'll bring this picture back up later in terms of why it causes issues for these type 1 and type 2 and type 3 malocclusions. Type 4, again, is not very common. This kitten is an example of it, but also had trauma previously, and so that's why he has this malocclusion. But you have asymmetric jaws. So your right side jaw and your left side jaw, they're uneven lengths, or your top and bottom jaw, they're uneven lengths as well, in kind of like a top and bottom asymmetric relationship. And also we call these rhybites. So why do we care about occlusions? Why does it matter? So going back to that overbite, basically, this overbite cat, as you can see, these lower canines are causing a puncture to the roof of the mouth. In this picture, there is a tiny hole on the side of that upper canine tooth area and also in the palate. That's just another view. Um, and it's not great because if you leave it for too long, past the kitten stage and way up into middle ages, you can potentially cause a risk for oral nasal fistula, which is basically a connection between the oral cavity and your nose. And also, if you can tell, it's ever so slightly close to those upper canine teeth. Those are going to dig a deeper hole and pocket into those canine teeth, creating bacteria to go into these pockets and basically causing periodontal disease, which we'll get into later, and possibly needing treatment for those teeth as well and or extraction. So what can you do instead in order to treat this malocclusion? You can do what we call a crown reduction and vital pulp therapy, which is a kind of endodontic therapy where we address the pulp of the tooth. So crown reduction just means that we reduce the length of those canine teeth all the way down to almost the level of the incisors. And then we basically put a medicament or filling on top that's biocompatible. We don't take out the root of the tooth, that stays there. And then we put a filling top over it. With this treatment, you usually need to do a follow-up in a year because we did put something foreign in the tooth. And also, we just want to make sure the vitality of the tooth has not been compromised. The other option you can think about also as well is extraction. And then this is another example of when we would think about these treatment options. This is a type 1 malocclusion cat where that lower canine is just ever so slightly jutted outwards towards the lips and it's causing a puncture in the lips. And you can see when it's closed. So again, you can think about those two treatment types. Baby teeth, same cat again. He has a multitude of problems. Baby teeth can persist even past 1 year of age. He, I think, was about 2, and you can see already like they're causing some kind of malocclusion as well. It can cause displacement of your growing adult teeth into a traumatic occlusion. So again, that baby tooth may have impacted the movement of that lower canine being able to move out normally into a normal position. And also it can crowd the teeth. So on the top, you already see a lot of tartar buildup, a lot of gum inflammation, and it can perpetuate this periodontal or gum disease, which we'll talk about more later as well. Sometimes you can also have a dental interlock, which is basically meaning that because of the impingement of these teeth, that lower jaw can't grow into its normal length. And so maybe perhaps that's why this cat has a shorter length jaw compared to other cats. And then also we worry about impacted teeth. That's something you would evaluate via X-ray. And treatment for these persistent deciduous teeth is that timing is variable and it depends if it's necessary. In this cat, I would most likely recommend it. I would recommend it any animal, just because of all the above points before. And going back to impaction, sometimes these baby teeth not only inhibit how that normal adult tooth grows, but that normal adult tooth never comes out. And so that is something to evaluate with a oral health professional like with our services. Type 3 malocclusion, again, is your underbite cat. There in this picture, there is a line right behind these canine teeth, and that's caused by those upper incisor teeth. And that's because he has that cute underbite. Sometimes it can cause an issue. It can cause deeper pocketing of those lower canine teeth that may need treatment later on. It may cause ulceration there. Some cats or dogs, they just don't even care about it and they just live their lives fine. But sometimes you may have to think about, hey, do I extract those 6 incisor teeth on top, which although they're helpful with prehension of food, they're very small teeth in a cat and not the end of the world if we have to, but something to consider. Um, Another thing that can happen with different occlusions, and sometimes again, going back to the type 1 out malocclusion, which is when one of your teeth are in a different position, is something called a pyogenic granuloma. These are benign soft tissue reactions and growths of granulation tissue. Again, it's secondary to this malocclusion, and mainly it's because of that traumatic contact with your upper fourth premolar. And as you can see on the top, there's this pointed tooth right there. There's 2 points to it. And if you can imagine, and you're biting down to your cheek, you're going to cause that irritation reaction or that granulation tissue to grow. So treatment would be to excise it because at that time, we don't necessarily know until we biopsy. We can only tell from our clinical surroundings and signs, submit that for biopsy for confirmation to make sure we're not dealing with something more insidious. And then also consider treatment of that upper fourth premolar despite it not having any disease, whether it's we just extract that tooth and then you don't have that issue anymore and don't have to deal with it, versus do we just, ever so slightly blunt those cusps down and relieve that pointed edge so it doesn't create this effect again. Not as best luck with that sometimes, and sometimes we just lead to extraction, but something to think about. Something that we see and get referred a lot is something called, or what used to be called, juvenile hyperplastic gingivitis, but it's called early onset gingivitis now. It's been renamed. And so it's inflammation of the gums of a young cat that can start as early as when a tooth is erupted. Specifically, most likely when their adult tooth comes in. And you see it as early as the 6 to 8 months of age. And the susceptibility of it decreases over time at around 2 years of age. This gum inflammation can turn into something called periodontitis, which is the inflammation of the structures that support your tooth and the gum tissue itself. If it's not treated, it can develop also into inflammation in the back of the throat. And it also, I'm jumping a little bit, can be related sometimes to the feline chronic gingivostomatitis, which we'll go over more later on. Some purebred breeds are known to get this, like the Siameses, Somali, Mancoon, Persians, Abyssinians, but domestic short-haired cats can get it as well. We don't know the cause of it. It is a highly suspect immune-mediated response to maybe the tooth eruption, whether they just have a poor response to bacterial load in the mouth, if it's viral exposure like FIV or feline leukemia virus or calicivirus. Those are the top three that are kind of suspects. And your clinical signs that you would see, and I hear about a lot, is you have the severe inflammation and edema. You have bleeding gums when they're chewing on our exam. And the bit also one thing is that they have gum enlargements that cover the crown of the teeth. Um, Sometimes there's pain, sometimes there's no caudal oral inflammation. And then because of your gum enlargements as well, they create these fake pockets. They're not real periodontal pockets, but that leads to more bacteria to hide in there and kind of continue the cycle of inflammation. So in this cat, I don't know if you can see, but it's ever so slight, but this gum tissue, this red gum tissue, there it is a little bit overgrown. And then we'll show you later what exactly we did for this cat. Um, the next step afterwards is aggressive periodontitis that it can turn into, or juvenile periodontitis. That's just in quotes because honestly, it starts and it can be seen in cats less than 9 months of age, but it can go up to, past that year. It can like 17 months. So it's not necessarily a kitten disease. It's something that you can see in young cats. But your predispositions remain the same, except that you for sure see it more in domestic short-haired cats as well. Your clinical signs is that you have more plaque and tartar accumulation, your gingivitis again. Big key thing is that you're starting to see significant early bone loss, pocket formation, furcation exposure, meaning that you can see in between the roots, gum recession, bad breath. Now you're having maybe there's more pain, and then the teeth are starting to become mobile. And a lot of commonly seen teeth that it affects is your last mandibular molar tooth or your also bottom incisors. And then where we see this early bone loss, that's where the dental x-rays come into play. And a lot of it is related to horizontal bone loss. And sometimes if you see a cat with missing teeth, despite it being so young, it's maybe possible that they already have this disease as well. So your treatment is at-home dental care. Start early, start young, start at 6 months when all those adult teeth are in. Brushing is very, very important. Sometimes you can use an antiseptic rinse called chlorhexidine for it's called Novident. But the biggest thing is coming into us and having that talk about having a anesthetized dental procedure with oral radiographs, which we deem called cohats. And you can start it as early as 8 to 9 months of age. We just did one for a cat, and then thinking whether or not do we be as aggressive depending on what we find every 3 to 6 months. So your professional periodontal treatment, which includes dental scaling, polishing, and charting. And then one thing is also gingivectomies. So in this cat, again, you see some overgrowth of gum tissue. Afterwards, this is after we use cautery to remove that gum tissue in hopes of improving his periodontal health, and removing those pseudo pockets. And then once it becomes aggressive periodontitis, luckily for this cat, it hasn't been yet, but but you would have to consider just extracting those teeth. There's not any other really great option for now for these cats. And so I keep talking about periodontal disease. And so what exactly is it? It's a pathologic process of progressive attachment loss around your tooth. And it goes under periods of where it's destructive and it's active, or what we call periodontitis, which is your active inflammation of the periodontium due to plaque biofilm. And I'll tell you in the next few slides what exactly make up this periodontium, and also goes through periods of quiescence. So a waxing waning sign. So when you guys are saying, hey, like it seems like I need, medication or antibiotics or something right now to help with it. But then, 2 weeks later, oh, everything seems fine. It goes through these wax and waning periods. It occurs underneath the gum line, so you can only see so much above the crown. It's really those roots below that are also very, very important and that we can't tell what's going on. And the main thing to know as well is that it's a chronic process and it's progressive. So it can be maintained, but there's not a end all cure to it. Like we don't do a dental for one time and then it's just gone forever. I wish. I wish that was the key. And then in the review of literature about overall cat and dogs, about 80 to 85% have a prevalence of periodontal disease. So it's a lot. And then within cat population, about 70 to 90% of cats. So that's a lot of cats that get this. And usually can start anywhere from 2 to 3 years of age as well. So not only your middle-aged cats. So what's your periodontium? It's your gum tissue, gingiva. It's your periodontal ligament, which holds that tooth in down here. And then cementum, which is kind of a hard structure that goes underneath the gum line or an extension of your enamel from your crown. And then also the alveolar bone that holds and forms a socket for that tooth. So your function is to anchor the tooth, cleanse and protect the tooth, and serve as sensory tissue. um how it happens and how the process forms of why it causes so much damage is that you have these salivary glycoproteins, and these it forms these things called dental pellicles within seconds of life, not even after eating, just having saliva in your mouth. And then these bacteria called gram-positive aerobic or oxygen dependent bacteria comes and colonizes this pellicle within 24 hours and creates this plaque biofilm, which is like this bacterial population basically. And then your gram-negative anaerobic bacteria, which are bacteria that are not dependent on oxygen, colonizes that biofilm after 24 hours as well. And that biofilm then becomes something that starts to be pliable and can be removed to becoming that calculus and that heavy tartar that you guys see on your cats and dogs within about 2 to 3 days. So it happens quite quickly, packs on really quickly. Yeah, and the gum inflammation or gingivitis can be reversible and seen within 1 to 2 days. The periodontitis that we talk about happen in within 1 to 3 weeks, and it can be sometimes irreversible. Some cofactors that may happen with periodontal disease. Again, your pure breed cats, not to just say, hey, every pure breed cat I have has perio, but a lot of them tend to do, like your Abyssinians, Somalis, Persians, and Burmese. We talked about dental abnormalities as well. So the crowding of the teeth kind of elicits more periodontal disease, your malocclusions, your persistent deciduous teeth as well. Genetics do play a role. And then sometimes systemic health and altered immune response if you have immunosuppressed cats or, patients in general, diabetes cats as well. They tend to pack on more severe periodontal disease, and vice versa. The severe periodontal disease can sometimes make the diabetes a little bit worse, and maybe there's some insulin resistance. Older age for sure, especially if you never think about doing a dental or checking the dental health ever. And then nutrition sometimes plays a role, especially if we're feeding a lot of wet food for cats, and we can't brush teeth at home. That wet food, again, is a nidus where like it just packs on into those pockets. It doesn't have like that crunchy effect like the dry food, and we'll talk about more of that later. And so local consequences a little bit different than dogs. You'll mainly just see tooth mobility, pain, which you guys must know cats hide their pain so well. And then the last stage, mainly usually that you may actually not see, is tooth loss. And this is an example of a cat we had. All that bone tissue is basically eroded away. That ligament that holds it, that tooth in, is gone, definitely needs to come out. Tooth root abscesses in cats is not as common, but can be seen compared to dogs. So you can see that facial swelling, your ocular swelling, maybe some bloody to muconasal discharge and sneezing, but it's not as common compared to dogs. And some other signs of periodontal disease. So you might start with the bad breath. Again, big signs is like, hey, I'm seeing bleeding or receding gums. You have your plaque and tartar, their reluctance to your petting. For cats, more they start to chew on like a specific side, or they're not liking a certain side, or chewing funny. Um, Abnormal jaw movements, hypersalivation, they're dropping food. Sometimes with cats, especially, they're pawing at a specific side of their mouth. And another thing is like decreased appetite and drinking. Um, just take that with a grain of salt, just because it usually takes for cats and dogs like a level 8 out of 10 to actually stop eating, or a 10 out of 10 to stop eating. And it's the reason is oral disease. So make sure you're checking out other causes, like kidneys, other systemic health issues before, blaming it on the oral cavity, because they tend to um, get used to it very well, but it's still something to be addressed. And then so stages of periodontal disease. So 0 is great, normal, nothing's wrong. PD1 or stage 1 is that you only have your gingivitis. There's no attachment loss yet. And this is something that we diagnose not only on charting, but also x-rays, and bone loss mainly. Stage 2 is your early periodontitis. So you have less than 25% of attachment or bone loss. Stage 3 is that you have 25 to 50%. And then stage 4, absolutely a goner, greater than 50% attachment loss. That tooth needs to come out. And so treatment options for periodontal disease is periodontal cleaning or periodontal treatment. So your chlorhexidine oral rinse that we talked about earlier to decrease your aerosolization of bacteria. This is for us in a professional setting of when we do those professional cleanings. So we have to get rid of a lot of tartar. So to reduce the bacteria in the air for our safety, we wear masks, we wear our hats or scrub caps, and use that chlorhexidine rinse. Then we professionally scale with an ultrasonic scaler. It does generate heat to remove those tartar bits. And we do it a little bit underneath the gum line, just being careful with our water and our heat levels, and also on top on the crown. And then polishing, not necessarily that, oh, it's going to keep away the bacteria, but it does help smooth out the surfaces after that harsh scaler is used on the teeth. And then the last treatment would be thinking about pulling teeth or exodontics or teeth extraction. Specifically for cats, there's not a great lot of ways to save teeth from periodontal disease. And we'll get into more diseases that affect cats as well that correlate with gum disease or periodontal disease. So one is feline tooth resorption, something we see very commonly alongside with periodontal disease. It is very, very common. It is a painful process, and it's the erosion of that hard dental tissues of the teeth, and it resorbs back into your surrounding bones. So the body is trying to resorb that tooth back into that jawbone, but in that process, it's creating those harsh ulcers that you see in this picture in the mouth, and also that gum inflammation. About 25 to 75% of cats at one point are going to be affected by the disease. So it's a wide range. And it can, if it's progressive, it can cause root resorption. It can cause fractures of the crown of the tooth. It can also lead to an open wound with a resorbing root remnant, which I've seen recently. And in very rare instances, it can sometimes cause what we call osteomyelitis or infection of the jawbone because of your, periodontal disease and your tooth resorption in combination, or, either or. And at least 33% of the cats will develop at one point tooth resorption, and likelihood increases with age as you get older. And also there's like an in-between gap. So you can start as young as 2 years of age, commonly around 4 to 6. And then your increased incidence of tooth resorption goes higher when you're 10 to 15 and older. And things we think about in terms of why, we don't know why it happens. It's deemed idiopathic right now, but it's an unknown activation of these cells in the tooth called odontoclasts. And they break down that bony structures of the teeth and remove that calcium from the internal tooth structures. And then it causes decay, not cavities, but just causing that breakdown of the tooth from within. Some theories of why it happens is that, again, your chronic periodontitis again. Is it that the tooth structure itself of a specific cat, where genetics may play a role? Is it viral? So feline immunodeficiency virus or feline calicivirus are kind of the heavy hitters of, potentially a reason why they could have it. A diet question mark, that's a huge question mark in terms of vitamin D levels. Again, I wouldn't take that to heart. And then how cats chew when they're stressed or biting, or how they're biting food down could be also a reason why one cat gets it more than the other. And diagnosis is usually, unless it's very, very obvious on exam, diagnosis is under your anesthetized dental procedure. Your periodontal charting, your oral radiographs are key because you can definitely see it underneath the gum line and not in the crown just yet. And then treatment of choice, we don't have a lot of treatment, but unfortunately it is extractions or what we call crown amputations, where the root is resorbed all the way to almost to the top of the crown, that all you have to do is cut off the crown and then suture over because that root is already being part of, has been becoming part of the jaw. Conservative management is also we do that as well. If it's not present in the clinical crown that we can see on our anesthetized dental procedures, we leave it alone and tell you, hey, come back in a year and let's reevaluate. And so just some stages and types of tooth resorption. So stage one is that, and something that we can't even physically see is that breakdown of your bony structure of your enamel or cementum. That's a thin layer that I can't even physically see. Stage two is when it starts to break into something that we call dentin. And that's the next inner layer that you can see here being eaten away. Stage three is that, great, okay, now we've broken into the pulp cavity. Stage four, which is broken up into, sub stages as well, is that it's not only in the pulp cavity, but it's almost everywhere. It's being eaten away everywhere. And A just means it's both on the crown and the root. B just means it's only in the crown basically, and then C is basically it's only affected in the root area. And then 5 means it's basically disappeared. You see remnants there, but it's basically gone. And then you have your types as well that kind of determine on how you extract these teeth. So type 1 means there's some resorption into the pulp, into that dentin layer, but you can see like a clear line, what we call the periodontal ligament that's still there. So that means we should do a full extraction. Versus a type 2, you can see that the roots are basically disappearing and basically almost gone. And so that means, okay, great, we can crown amputate this crown, leave the roots behind because it's basically almost gone, and then close that up. And then in some instances, you have a mix of both or type 3. Now leading into tooth resorption, which can sometimes be also linked to feline chronic gingivostomatitis. Cats love to have these inflammatory processes in the mouth. It is severe inflammation, ulceration of the oral cavity. If I had to grade things, so you have your early onset gingivitis, then your aggressive periodontitis, then that kind of correlates also with tooth resorption. Then your final stage of the worst oral inflammatory disease in the mouth is your feline chronic gingivostomatitis. Clinical signs you'll see is oral pain, dysphagia, or how they're eating is not great, poor appetite, weight loss. Your prevalence, about up to 26% of cats they found recently in the last 2 years now. So it's increased from before what they thought was 12%, and more likely to be seen in a multi-cat household. Not saying, if you have 5 cats, all of them are going to get stomatitis, but definitely in like large shelter situations, more cats you have, it seems to be a trend that more likely that one or a few cats are going to have this. Average age is about 7 years old. but you can definitely see it younger as well. And the etiology, again, we don't have a clear-cut answer, but it is some kind of immune-mediated disease in response, the local and systemic response to a chronic antigenic or some kind of chronic stimulant. Whether that's if they had a viral load relation before, or they had a virus before, like again, going back to feline calicivirus, whether it's feline leukemia virus related, plus or minus relation to FIV, but it seems like there might be a stronger link to feline leukemia at this time, but FIV is still very important. And so that's why a lot of times when you anyone comes in for a consult for stomatitis, we ask, hey, has your cat been FELV, FIV tested, just so we know how, potentially things could be responded to treatment. Diagnosis is presumably mainly presumptive. It's the biggest difference between all the oral inflammatory diseases we talked tonight is that stomatitis, you'll see the caudal inflammation or that caudal mucositis in the back of the throat. In this picture, all the way towards the right, you see that it's very angry, very red in that back area. Once we see that, we know, hey, your cat has stomatitis for sure. And there's different levels from mild to severe, and how we can treat. And it's not wrong to biopsy. That's definitely a definitive diagnosis. And just in case to rule out other things, that's not stomatitis or any neoplastic or cancerous areas. Treatment is partial to full mouth extractions. So depending when they come into us, if it's a fairly young cat and has all its teeth, we're going to recommend full mouth extractions. Any extractions is the mainstay of treatment right now. You do have about anywhere from 67 to 80% of success rate, depending on the paper you take from. And you have to remove every single tooth, even if there's a tooth remnant behind. And so sometimes a lot of these cats have tooth resorption as well, and we have to hunt and dig for these roots as well. This cat has a proliferative form of stomatitis. It's very unfortunate that he did. We took out all the teeth. This is post-operatively immediately, and then this is him about 2 to 3 weeks later, which is great. He has also a traumatic palate open, but that's something else. But even though we do these full mouth extractions, about 20 to 33% of these cats will be refractory, meaning that they won't respond. They won't have this great response of the proliferation goes away, the inflammation goes away, unfortunately. And so what do we do if the full mouth extractions don't work? We start to go to our immunosuppressants like prednisolone, your steroids. It's not our favorite, but it's something that will help with the pain immediately and the inflammation. We hope that it does. It does still have about like 30-40% efficacy. But the thing is that long-term use, we worry about diabetes development in cats. And so sometimes we switch after we do like a month or two course of steroids. Do we switch to cyclosporin, which is another immune-mediated drug? It is a little more expensive than prednisolone, but the side effects are definitely way less. And it does take at least 4 weeks sometimes to come into effect. Also, pain control. Like, let's say there's a little bit of inflammation left, but the pain is the main issue. Do we think about, do we use your nonsteroidal anti-inflammatory drugs, your opioids, gabapentin for neuropathic pain, amantadine, which is something used in humans for antiviral, but has been in use for chronic osteoarthritis cats recently, and there's some kind of pain property there. And then these other two are something that are kind of experimental in a way. It's not commonly used, called one is feline recombinant interferon omega, and it's used to help treat viral diseases as well. And it basically impedes the viral replication. So if there is a viral component to stomatitis, again, we're not 100% sure, then it may be effective and may help. Mesenchymal stem cell therapy from fatty tissues. That has also been used in terms of trying to treat it as well. And it has an immunomodulatory effect that may help with stomatitis. But overall, like if stomatitis and aqua, and I have not had this happen yet, is if we can't control with these medications like the steroids and the cyclosporin mainly, and you try everything, if and the inflammation's getting out of hand, he's not eating, she or he is ill, thinking about humane euthanasia sometimes is not a wrong idea. So what can you do for your cat's oral health overall? Come to us or go to your regular veterinarian and get a professional dental cleaning or care. And so we don't only clean, we do everything. So what COHAT stands for is your complete oral health and assessment and treatment. General anesthesia is mandatory just because we do protect the airway. I know there's a lot of anesthesia-free places, but anything comes with a risk that water that is done for the cleaning goes down the airway and down the windpipe. For us, we suction every patient afterwards to make sure we decrease that risk. And another big thing, if you don't do it here, but anywhere, please ask if they do intraoral radiographs. Again, you're only seeing so much in the crown and they're cleaning so much in the crown. If you don't see what's below the gum line, you're just basically, putting makeup on a like really dirty donkey. Sorry, that was a bad metaphor, but you're just basically putting makeup on a clown in a way. Like you're not really getting to the root of the problem. And so it may be a really diseased tooth that needs to be extracted, but you can't tell because on the top it looks pristine. We chart RV teeth. Periodontal treatment includes your scaling, your polishing as well, and then appropriate treatments, meaning extractions, your crown amputations, your endodontic therapy, like the vital pulp we talked about. That all happens under that anesthesia. And the frequency really depends on the individual. I've had cats that have pristine teeth and they come to me like, once every 5 years, and that's like, oh my gosh, that's amazing. Or, you have your cats that need that cohat every 6 months, or even, mainly the average is a year. So it depends on the patient. These are just some examples of the dental x-rays we take in patients, charting we do in our x-ray beam. And so just rounding things out. So what can you do at home? What kind of dental care that you can do at home? And I feel like I kind of hammer this down every year. And it still hasn't changed my answer, but toothbrushing, it really does go a long way. Even for cats, I know it's hard for a cat sometimes, and it does take time. It's especially for someone who's new to it and just starting, and if you have an older cat. But it's the most effective home care plaque and gingivitis control. And especially when you have your kittens, you're worried about that early onset gingivitis and aggressive periodontitis, it's going to go a long way. Your gold standard is to do it daily, but every other day is just as effective. And we recommend like a soft bristled nylon toothbrush. So something soft bristle, something that's easy on the gums and the teeth. And it's that mechanical movement, not the toothpaste, not anything else, but your mechanical motions of brushing that will remove that plaque biofilm. And an application, you should start it, as early as possible. And even when they're kittens, just like start putting your hands in their mouths, desensitize them to that kind of contact. Positive reinforcement, meaning, after he gets a toothbrush in his mouth just for a little bit, he gets a treat, or the whoever gets a treat, Fluffy gets a treat, and a consistent routine. So if you only do it once or twice and give up, then, it's not going to work. It's something that you have to practice kind of almost every day or every other day. And I do understand that some places are going to be harder to reach, especially the inner portions of the teeth towards the tongue and the palate, especially all the way in the back. It takes time. It takes, start with the cheek side of the teeth. That's most important to me in the beginning. And then as you progress and get more comfortable, you can kind of go towards more the inside. And even though you're toothbrushing, do not forget your anesthetized dental procedure. It does go a long way, just like you or I who goes to a dentist once a year at least. There's still a lot of things we can't see below the gum line that need to be addressed. And I've been very surprised here and there, and even now and forever in the future. So this is an example of a cat toothbrushing, very popular. Our previous resident, Dr. Ford, has lovely cats at home who are starting to get used to their toothbrushing and probably are way ahead right now. So he's just desensitizing and getting his cat used to the toothpaste. So this is all him getting desensitized. So he's just feeding the toothpaste. Again, if you don't want to use toothpaste, and the GI is an issue, that's okay. But just getting him sniffing the toothbrush, you know, swatting at toothbrush, anything, licking toothpaste off toothbrush, or putting a treat, or, putting him near a toothbrush, and then just starting with a circular motion. That's what most people commonly do. Um, so aiming to brush 30 seconds on each side. So we like to talk about four sides. Sorry, that was kind of loud, but we like to talk about four sides. So your top two, and then the top bottoms. And also I would also consider, I'd say six sides, your front teeth as well. Um, Okay, and then this is just a fun video of a seal getting her teeth brushed. Just a bonus that sea lions, their teeth are very similar to dogs actually. But I thought this is great. Like if they can, try to brush a sea lion's teeth, you guys can also try to, brush your cat's teeth or your dog's teeth at home. And then so she's doing your positive reinforcement of the treats, and then it's open nice and wide for her. And the black on the teeth for sea lions is normal. That's actually their plaque and bacteria on their teeth, which are hard to get out. So yeah. And then nice whistle. Sorry, I don't know what's happening. There we go. Okay, so toothbrush recommendations. We currently really like the Nimbus or Nimby Kid toothbrushes. It's a human product. I use it. I think my oral health has improved with it. Compared to my electric toothbrush I used to use. It was too harsh on my gums. But it's just the soft bristles are really nice and it maintains your periodontal health. We always joke that we should have stock in this because we've been recommending it to everyone. But again, we don't have any stake in this. We just really like this toothbrush, and it doesn't specifically have to be this one. Just something soft, soft bristles, that we would recommend. Other adjuncts, so toothbrushing is number one. That can't replace anything. But some adjuncts you can use is, using your toothpaste. There's Pet Smile and CET enzymatic, which are great. Your dental wipes or gel. If you can't do toothbrushing and you're really, really having a hard time wiping the tooth, that will help. And having a gel formulation, we like MaxiGuard here. And dental diets and treats. So we talked about wet food can kind of stick on the tooth a little bit more, but that crunchiness or that crunchiness, that crunching of the dry food or the treats also helps break down some of that plaque as well. Not so much of the hard tartar if it's already way encapsulated, but that plaque accumulation. And then water additives are kind of low on my list. If you're doing everything else and you want to go ahead and do water additives, totally fine. No harm there. Just make sure your cat can tolerate it with its GI system. In summary, overall, so we just want to recognize these dental and oral cavity abnormalities early on. It's a multimodal approach to maintain good oral health hygiene. And then don't forget your yearly exams with your primary veterinarian or with your friendly veterinary dental specialist down the street or up the street. And just making sure everything is okay there. Um, if you want to go ahead and take a look in your cat's mouth or dog's mouth as well, with the signs that we talked about, frequent toothbrushing, do not forget to toothbrush or just give it a shot. If you put it away, bring it back out again. And also you consider these crunchy oral treats as well. I think that would be great too as an adjunct. And don't forget, like, don't have a talk with your doctor. I understand our patients, especially our elderly patients, have a lot of comorbidities or other health issues that we worry about anesthesia, but it is very important to do it so we can be able to, really diagnose the disease, get the diagnostics we need, and really be able to have a good treatment plan for your little feline friends overall, not only then, but also in the future. So don't forget to think about doing it, if not once a year, but like at least sometime in their lifetime. Um, and some resources that are great for you to go to is American Veterinary Dental College, AVMA as well. And then in terms of products, we like Veterinary Oral Health Council is they have a nice website. It just has a seal of approval, meaning that a bunch of boarded dental specialists have reviewed the literature behind certain products and they like it. Doesn't mean that if they don't have this approval that, you can't use it at all. If you're not sure, feel free to ask us or your primary veterinarian. So now I think I'll leave the room for questions. That was a lot of information. So yeah, that's the end of my presentation tonight.
Well, thank you so much. This was fantastic. This is Dr. Toe's third USDAN presentation, and it just gets better and better every year. So thank you so much. We so
Thank you.
appreciate your time and
Mhm.
everything. So if you want to unshare so we can see you.
Yes.
And then we do have some questions, and we'll get to
Mhm.
as many as we can.
Mhm.
Um, let's see. So we have one. My Abby loves her morning toothbrushing with
Mhm.
enzymatic toothpaste. However, I don't think I'm actually brushing all of the teeth. Does the
Mhm.
enzymatic toothpaste help with that?
Yeah, so the enzymatic toothpaste helps break down some there's like a calcium deposit that helps break down the tartar a little bit. So if you're not getting to the affected area, I don't think it's going to, get to the areas. I think again, it's more of getting to the toothbrush of where it needs to be in your mechanical motions. That enzymatic toothpaste is just a great as a like an adjunct. Yeah.
Okay, great. And then people are asking 30 seconds on the top, but we will
Yeah.
send the video, a link to the video, as well as the link to the recording. I think is it do as much as you can, I think, right? So,
Yeah.
and then I know we had a question too that we say to concentrate on the outer surfaces.
Mhm.
Should they try to get to the inner surfaces too, or just,
Yeah, if you're already
yeah.
able to get to the outer surfaces, like it's awesome extreme bonus points if you can get to the inner
Yeah.
side. And I know a lot of people like our thought is, okay, we're gonna open them wide up and stick the toothbrush in. But sometimes like just like having that toothbrush sneak in there and letting them chew on it as well is definitely helpful if you're not able to do that.
Okay, great. Let's see. Do we need toothpaste? Someone's
You
asking.
don't necessarily need it. It definitely does help. I think some things we recommend, especially if you have like GI sensitivity, is doing a little bit of saline water. So like a teaspoon of salt with a cup of water will also help with kind of breakdown of some of that plaque as well. But it's really the mechanical motions and the movement.
Okay, great. Then we have some questions. My 10-year-old cat has had extractions twice over 3 years and has a
Mm.
few teeth left. I've been told
Mhm.
the cat's body is rejecting the teeth. What exactly is going on? Is it an autoimmune disease or reaction to plaque? This is actually from a human doctor. So
Oh,
if you
got it.
want to say,
I
yeah.
think most likely if there's no, it doesn't seem like there's caudal inflammation in the back of the throat, which we always worry about gingivostomatitis. So it most likely is that your cat is being affected by tooth resorption. And again, it's very common. It can be an ouchy process when it is happening, but a lot of times it happens and you don't even realize it. So that's probably what they're talking about. The cat's teeth are being rejected, but I can't rule out that there's periodontal disease as well.
Okay, this is similar. We recently rescued a cat who was a trap neuter release cat.
Mhm.
Age is unknown, but he doesn't seem to be senior cat. One day he yawned, and we noticed that he doesn't have any teeth other than a stump of a tooth in the back. His gums seem
Mm.
healthy. Any idea why he's toothless?
I think also tooth resorption,
Mm.
again, very,
Yeah.
very common. And he's probably older than what he is, especially a lot of the older cats tend to be missing a lot of teeth. So he may be a little bit older and he probably has some like little resorb remnants left that we just need to look at for. But if he's otherwise okay, we'll just leave him be. Yeah.
Leave him be, or should he be checked out? Or
If he's
yeah.
eating, drinking okay, and you're not seeing a clear cut of, inflammation, again, not wrong to come see us and just take a quick look and make sure everything looks okay, especially if there's a stump of a tooth left. But otherwise, if there's no inflammation, I wouldn't be as worried about it, and I would watch his appetite.
Okay, great. Does using gauze instead of a toothbrush work for those cats rejecting the toothbrush?
So, oh, rejecting a toothbrush.
Yeah.
Yes, if you can't get a toothbrush, which is a hard object to get into, or you can't find a small enough one, just sometimes using that wipe in your finger, is great. I know there are finger brushes, but as long as that finger brush is like a semi-soft bristle, that's most important to me.
Okay, great. Can you speak a little bit about the sealants and whether those are helpful?
Yes. We don't do it as much as in cats compared to dogs, but it is definitely an option. The sealant is supposedly used for if you can't brush your animal's teeth at all. But it's a catch-22 in terms of that. It's supposed to last 6 months, but we don't really know if it lasts that long. Also, we don't know if it's clearly, truly blocking out all that bacteria going down to the gums. So it's something that you can try, something that is, not wrong to do. But whether or not it really prevents, the periodontal disease is one question, but also it does not prevent tooth resorption. So we can't control that.
Right. I'm worried about anesthesia, my older cat. I know we hear that a
Hmm.
lot. How
Yeah.
safe is that for a 14-year-old cat?
Yeah. And again, I like to say age is not a disease. It's more of like what other health issues, like again, the diabetes, the heart disease, is there, feline asthma? How did they respond to anesthesia before? And so that's something like a conversation to review medical records and with us as dental specialists or with a primary veterinarian who's doing it, and checking blood work, checking chest x-rays to make sure nothing is wrong. So we go through a lot of steps before we even think about doing the full procedure.
Okay, great. And should an anesthetized exam be done each year?
Ideally, yes, but we also understand like it's an anesthesia for your friend, for your cats, every year, or your dogs. You have to be comfortable with. I mean, we're very comfortable with it. It has to depend on, has there been any change in health? Um, it really depends on many factors, and so it's just a discussion for us to have. But ideally, once a year, if you have a healthy animal.
Okay. Okay. In a multi-cat house, does each cat need their own toothbrush?
I would like to I'm just very paranoid about oral, like just cleanliness. So I would say yes, but I mean, if they are brother and sister, I have had people say they share toothbrushes with their within the cat family and it's okay. So I think it's fine. Again, I think it's up to your discretion. I know if you have a lot of cats, a lot of toothbrushes will get more expensive, but I'd say try to keep it one per. But yeah. Mhm.
Okay. No. Do cats with do cleft palates affect the teeth? Let's see.
Not necessarily affect like in of itself, but because there's a connection to your nasal cavity, then you have not only like bacteria from the nose, but also food from your oral cavity going to the nose and vice versa. So just more proliferation of bacteria able to go into your pockets, and causing inflammation in the mouth that way.
Okay, great. What age should dental cleaning start?
And it depends. For a healthy cat, no issues. You can think about starting to do about 2 years of age and onwards up. If you have that early onset gingivitis, I mean, we've done it as young as like 8 months as of right now. So it really depends. But yeah.
Okay, great. Let's see. My cat has had all of her molars removed due to dental disease. Should I still brush her teeth?
If she still has remaining teeth, I would highly recommend. If she doesn't have anything, then you're off the hook.
Okay.
Yeah.
Let's see. Uh, we had our clinic would recommend extraction of deciduous teeth if they are still present at 6 months of age. Is it better to leave them and wait until they're older?
The longer you wait, there's more risk of, that periodontal disease, how the adult tooth grows in, because sometimes it does take an extra month, maybe two. Again, every cat is different, but mainly an extra month of how that tooth grows in. It's not wrong to coordinate it, especially a female cat or, male cat that you need to neuter for some reason at that age already, if it's a later cat that you adopted. Um, but I would probably, again, I think it's a conversation to be had. It really depends on many factors, not like your own personal factors and also how the cat's doing. But it's not wrong to start as early as 6 months. Yeah.
Okay. Okay, great. My cat has gum disease. What is the best way to rinse his gums with chlorhexidine? Or also, is that a good
Hmm.
thing to use? What do you do, I guess, with cats with gum disease?
Yeah. And then it's going to go back to
Yeah.
toothbrushing, brush the
Yeah.
teeth. But if you need to use a rinse, it's not wrong. It's not going to get rid of the gum disease. It's not as helpful. It's just kind of like if you can't do anything. But also it's also quite bitter, so some cats may not like it.
Okay. We have many people saying very informative. I enjoyed the visual guides. And we have some people asking, do we have a dental webinar for dogs? And we absolutely do. We have about 5 that are for cats and dogs, 2 of them by Dr. Toe. So we will send those links. We just really wanted to give a chance to focus on feline dental health because cats often get the short shrift on these. So we really just wanted to focus on this, but we will, and you can send those to everyone tomorrow, along with the link to this one. Let's see. How often do you recommend FIV positive cats get cleanings?
I don't think that will change my answer of like saying once a year. If they are for some reason exhibiting a lot of gingival like inflammation and significant bone loss early on, I'd probably say every 6 months if they're willing to. We do have a dog that has very bad gum disease. Again, this is a dog and she comes in every 6 months and she's our little frequent flyer and does great. So I think it depends, but once a year is should be okay.
Okay, great. And we'll finish on this one. This might be a
Mhm.
yucky thing, but how
Mhm.
could we describe cats' bad breath due to
Oh
periodontal
boy.
disease?
I also have a skewed sense of smell, so I have to go really close, but it's kind of like a fishy, to me it smells fishy. Um and it kind of smells a little blood tinged to me, but that's how it is for me. But my sense of smell has been a little bit off lately. So
Okay,
yeah.
okay. All right. And we have many people saying thanks for focusing on cats tonight. So yes. Okay, well, thank you, Dr. Cho, for such an informative and insightful presentation. We really appreciate you sharing all of your expertise with us tonight and over the past couple of years. Special thank you to Kimberly Young for her work in organizing this and all of our events. And of course, to all of you for joining us tonight. We're so grateful for your time and your commitment to your pet's health. Just as a reminder, we'll be sending out a recording of tonight's webinar tomorrow afternoon, so keep an eye on your inbox. And don't forget to register for our next webinar, Behavior Solutions for Pet Owners with Dr. Vanessa Spano on Wednesday, March 19th at 6 p.m. And with that, have a great evening, and we hope to see you at our next event. Good night, everyone.
Bye. Good
Thank
night.
you.
Bye.